A dangerous, drug-resistant fungus spreading through hospitals and nursing homes nationwide has made its way to the mid-state. Good evening, everyone. I'm Rory Johnston. The fungus is called Candida auris, and it's forcing emergency response changes at a Columbia nursing home. Tonight, News Channel 5's Patsy Montesinos explains why it's keeping first responders on high alert and who health experts say is most at risk.
A dangerous fungus has made its way inside Magnolia Healthcare and Rehabilitation.
Candida auris is a form of yeast infection.
Candida auris is the reason Columbia's fire and rescue leaders directed personnel to stop responding to medical calls at Magnolia until further notice, and instead handle only fire-related emergencies, according to a memo obtained by News Channel 5.
It's a special strain of yeast that appeared about 8 to 10 years ago for the first time in Japan, and then spontaneously in other parts of the world, and then came here.
Since the first U.S. case in 2016, this so-called superbug has spread rapidly, topping 6,000 cases nationwide in 2024. Last week, the Tennessee Department of Health confirmed 8 active cases and 40 clinical cases of Candida auris in the state this year.
It likes to prey on very sick people who have intravenous lines, machines helping them breathe, and the like, who are already being treated with other antibiotics. Given that these people are very frail, Candida auris infection can push them over.
Vanderbilt University Medical Center infectious diseases professor Dr. William Schaffner says this is not something spreading in the general public. Instead, it attacks patients who are already weak. That's why he says hospitals and nursing homes is where this fungus is spreading.
Particularly if some of them already have IV lines and such, who are requiring that special, more intensive care. That is a setting in which this Candida auris can spread.
And unlike other yeast diseases, this drug-resistant fungus can survive on surfaces for a long time.
If a visitor had gone to that nursing home and interacted with a patient who had Candida auris, they need not be concerned about either becoming ill themselves or spreading it to others, unless they had someone who was frail in their own home.
Patsy's with us now. So what does this announcement actually mean for folks in the nursing home?
Rory, in Murray County, EMS is a separate agency from the fire department, so patients there will still get this medical help when they need it. I spoke with someone from Murray Regional EMS over the phone, and they told me that they usually only call in the fire department as it's needed. Right now, fire crews will respond to fire-related calls like alarms and structure fires.
Good to know. As for this fungus, did the doctor give any additional advice on how to avoid it?
Yes, he did. And just like any other fungus, good hygiene, like washing your hands, is the best way to keep it away. But he does want to emphasize that this is not something that everyday person should panic over, but it is dangerous for people who are already vulnerable. For nursing homes dealing with Candida auris, he encourages them to work closely with the Tennessee Department of Health to get it under control.
Sounds like everyone's on high alert, which is a good thing. Patsy, thanks.